Hi, I'm Dr. Sharbel Hashul, and today let's clear up something that confuses a lot of people. What's the difference between a core needle biopsy and a fine needle aspiration? If you've ever been told you need a biopsy and heard these two terms tossed around, you're not alone in wondering what they actually mean. Let's start with the basics. Both of these procedures are ways for doctors to take a small sample from a suspicious area in the breast, usually something seen on a mammogram, ultrasound, or MRI, or something felt during an exam, so that it can be looked at under a microscope. The goal is simple: to find out exactly what that area is made of, whether it's something completely harmless or something that needs further attention. Fine needle aspiration, often shortened to FNA, uses a very thin needle, similar to the kind used for a routine blood draw. The doctor gently guides this needle into the area of concern, often with ultrasound to help see exactly where it's going, and draws out a small number of cells. Think of it like collecting a few grains of sand to examine closely. Because the needle is so thin, FNA is quick, generally very well tolerated, and rarely needs more than a numbing cream or a tiny bit of local anesthetic. Core needle biopsy is a bit different. It uses a slightly larger hollow needle that removes a small cylinder or core of tissue rather than just individual cells. Imagine taking a small, thin, noodle-shaped piece of tissue instead of just a few grains. This gives the pathologist, the doctor who examines tissue under the microscope, more material to work with, and importantly, it preserves the tissue structure. That structure matters because how cells are organized within the tissue can be just as important as what the individual cells look like. So why would a doctor choose one over the other? In breast care today, core needle biopsy is the most commonly used method when there's a solid mass or a suspicious finding on imaging. That's because it gives enough tissue to make a clear and reliable diagnosis, including details like whether something is invasive or non-invasive, and information that can guide next steps if needed. Fine needle aspiration is still very useful in certain situations. For example, when checking a lymph node, evaluating a fluid-filled cyst, or when a quick answer is needed and the clinical picture is straightforward. Both procedures are typically done in an office or outpatient setting, often guided by ultrasound so the doctor can see the needle in real time and make sure it reaches the right spot. Neither one requires general anesthesia. Most people describe some pressure or a brief pinch, but significant pain is uncommon. Afterward, a small bandage is usually all that's needed, and most people return to normal activities the same day or the next. One important thing to understand is that neither test is better in some universal sense. They're simply different tools for different situations. Your doctor or radiologist will choose the one that gives the clearest, most reliable answer for your specific finding. Sometimes core needle biopsy is recommended because the extra tissue helps avoid ambiguous results that might require a repeat procedure. Other times, FNA is enough to answer the clinical question quickly and with less tissue removed. Here's the practical takeaway. If you're told you need a biopsy, it's completely reasonable to ask your doctor which type they recommend and why, what the recovery will look like, and how soon you can expect results. Understanding the reasoning behind the choice can make the whole process feel less intimidating, and it helps you know what to expect on the day of the procedure. It's also worth remembering that needing a biopsy does not mean cancer is expected. Biopsies are done to get clear answers, and most breast biopsies, in fact, turn out to be benign, meaning not cancerous. The purpose of the test is simply to move from uncertainty to clarity. As always, this video is meant to help you understand the general process, not to diagnose or guide treatment for any individual situation. If you have a specific finding, symptom, or upcoming biopsy, please talk with your own doctor, who can explain what's right for your particular case. Thank you for spending this time learning with me today, and I'll see you in the next video.